Okay, Lisa, we're live.
Okay.
Welcome everybody to Wall Street Reporter's next Super Stock live stream, February 24th, 2021. We are back with Reliq, RQHTF, over-the-counter RHT in Canada. Lisa, welcome back.
Thank you. Thanks for having me back.
Lisa, a very exciting day today. For the stock, I think from an investor's perspective, is that you have this. You just announced your third contract, third deal in I think about 30 days.
Yeah, no, this is definitely going to be our breakout year. I think I said that to him, and it's still very much true. Definitely, the pandemic was a very slow year for businesses in this sphere, but, other than the basic telemedicine virtual visit companies. But now that the vaccine's rolling out, there's just huge growth in the space, and certainly in our business. And this is really just the beginning.
So I want to go today. With the format for today is we're going to do because we haven't seen the slide deck yet. Today's the official. We're going to tell the official story. Then we'll go back to audience Q&A in about 10 minutes, 15 minutes. We'll go Q. But I think it's very important. I want to really talk to you about that. This real kind of an inflection point right now where you're really the company's. I think the message is that when you have 3 deals announced like this in 30 days. It shows that there's real traction starting to happen. So it's an exciting time, for investors to take a look at a stock like this. So, all right. So for anybody that is just joining the next Super Stock live stream, what this is about is bringing you those stocks which have that 10x to 100x upside potential. We've already seen a number of them in the past, 18 months. We had a stock that's up 50x in the last 4 months. It was at Empower. So from a nickel to $2.50. Lisa, you have to catch up to this now.
Yes, that's right. That's my goal.
We need
the new leader for your business.
We need the first 100x. So we need a 100x stock. The companies that we're focusing on they have 3 things in common. They're going after massive market opportunities. They're at a key inflection point, and there's multiple catalysts in place to unleash shareholder value. And I think Reliq, fits all checks off all 3 of those boxes. I think especially that inflection point at this time. So with that being said, please watch the presentation. After we're done, please ask Lisa your questions, and then decide for yourself if our Reliq is going to be that next super stock, that 10x to 100x winner. So Lisa, let me get your presentation up on the screen, and we'll get started. Okay, here we go. Okay, full slide. Okay. Okay, Lisa, it's on the screen, so I will disappear and I'll see you when you're done. Okay, take it away.
Great. Thanks very much, Jack. So as Jack said, my name's Lisa Crossley, and I'm the CEO of Reliq Health Technologies. We're a digital health technology company, and we're a global company, but our primary market with customers is in the US. And I'll provide a brief overview of the company and our technology and go-to-market strategy in this presentation. Standard forward-looking disclaimer here. You can read that at your leisure after Jack has posted this on his website. So we are a Canadian company. We're headquartered just outside of Toronto, but we have offices in Texas and Florida. Those are 2 of our largest client bases, are in particular South Texas and Florida. But over the last year, we've really been expanding across the US, such that we now have clients who have operations in all 48 of the contiguous states, as well as in Puerto Rico. We also have a small presence in Canada and in Australia. And our business targets the $100 billion virtual care and chronic disease management market. It's a very large market. It's also a very rapidly growing market at the moment as the population ages and grows. A little bit about our team. For myself, this is the 4th company that I've run as CEO, the first publicly traded company, but I was in management at a publicly traded company in Boston early on in my career. We actually had our IPO while I was there in the summer of 2000. I ran all of our global biomanufacturing efforts, and we had a highly successful IPO, and then ultimately the company was taken private again through an acquisition by Shire Pharmaceuticals for $6 billion. My first company privately held, sold to Millipore Corporation, which is a multinational, multi-billion-dollar company, and it's based in the US, and was later acquired by Merck. And then most recently, I sold Vital Hub Corporation to a group in Canada who had just exited another company called MedWorks. I've raised well over 60 million in venture capital and angel financing from primarily US investors, including D.E. Shaw Ventures in Cupertino, California, and a number of the Boston angel groups. My technical team, Rob and Lucas and Basma, are very well qualified, very experienced, literally decades of experience each in the space, with a particular focus on healthcare. So they've been able to really help us take the company and our technology platform to the level it's at now, where we're capable of supporting millions of patients simultaneously. And we relatively recently, brought on our CFO about a little over a year ago. Matt has a lot of experience in working with companies like ours who do the bulk of our business south of the border. So that's been very helpful to us. In conjunction with bringing Matt on, we also switched auditors and moved to KPMG. I think it's really critical for the company that we're working with one of the big four as we contemplate things in the future, like a NASDAQ listing, which we hope will happen early next year. And our Chief Medical Officer, Dr. Joyce Johnson, is based just outside of Chicago, and she's really been invaluable in helping us to not only understand the clinical workflows around chronic disease, but in particular to navigate some of the complexities of Medicare and Medicaid. So the context for our business. In the developed nations, so Canada, the US, most of Europe, the chronic disease patient population accounts for roughly 20% of the total population. So about 20% of the population has chronic diseases like kidney disease, chronic obstructive pulmonary disease, which is also known as COPD, hypertension or high blood pressure, diabetes, and congestive heart failure. But that 20% of the population accounts for over 80% of healthcare spending. So it's a very big disconnect between the number of people and the size of that expenditure. So in the US alone, last year, roughly 18% of GDP went to paying healthcare costs for chronic disease patients. These patients are expensive because they experience a lot of preventable complications, and those complications result in hospital stays, ER visits, ICU admissions, very costly settings for care, and very disruptive to the patient and their family having to be admitted to hospital with these relatively frequent complications. And the reason that those patients experience preventable complications is because they're responsible on a day-to-day basis for managing their own complex chronic diseases in the home. So you've got a patient who's maybe 75 and might be dealing with high blood pressure, diabetes, and congestive heart failure or kidney disease. These are really complex chronic conditions, and it's very difficult for them to manage those on their own, to remember to take their vitals consistently, to remember what are the warning signs, and remember to contact their clinical care team if they show any of those warning signs. And we know that less than 50% of this population takes their medication as prescribed. So that alone has a really significant impact on health outcomes for these patients. And CMS, the Centers for Medicare and Medicaid Services, recognized that this is a key problem that's driving healthcare spending for them. And so about 5 years ago, they started a significant change in the way that they compensate healthcare providers. So they moved away from the conventional fee-for-service model, where a doctor will make more money the more often he sees a patient or she sees a patient, to a value-based payment model. So essentially, healthcare providers are now incented, they're compensated for keeping patients out of the hospital and for preventing a lot of these preventable complications. So it was actually incredibly progressive, and I think a lot of us in healthcare had been waiting for that sort of sea change away from fee-for-service and towards value-based payment. We didn't necessarily expect it would come from CMS, but it did. And over the last 2 to 3 years, Medicare and Medicaid have really proven to themselves, they've validated that model, that providing a more proactive approach to healthcare and investing upfront in compensating healthcare providers for preventing hospitalizations results in a very significant downstream change. So a significant improvement in health outcomes and a corresponding decrease in healthcare spending. And that's really been enabling for our business. So our platform, we're a cloud-based software as a service, and essentially what happens is that a patient will be prescribed remote patient monitoring, let's say that's one of our modules, by their healthcare provider. The provider will prescribe the relevant monitoring equipment. So, pardon me. For a diabetic, that would be a glucose meter. It might also include, for a congestive heart failure patient, a scale and a blood pressure cuff. For a COPD patient, it would be a spirometer that they can blow into. And the patient will be enrolled in our system. And essentially, every time the patient captures their vital signs using that equipment, we collect the data either via cellular or over conventional internet access enabled by Bluetooth. And that data is immediately uploaded to the cloud. And then we deliver real-time alerts to the clinical care team. So, for example, with a congestive heart failure patient, we know that a sudden 2-pound weight gain in 24 hours indicates they might be going into heart failure. And so if the physician can change the prescription for their diuretic medication or potentially change their cardiac meds, you can keep that patient healthy and at home indefinitely. If you wait until the patient recognizes the symptoms of increasing fluid, so that would be a feeling of pressure in the chest, chest pain, difficulty breathing, they're typically looking at an ICU stay. And perhaps more to the point, and they've typically done permanent damage to the heart. So not only are they going to spend a week to 3 weeks in the hospital and cost the healthcare system hundreds of thousands of dollars, they're also going to come out in a little bit worse health than before the episode occurred. So if you can catch these destabilizations or exacerbations early in the home, you can have a really significant, frankly, profound impact on health outcomes for these patients and also definitely on healthcare costs. And our platform supports a number of modules. So remote patient monitoring is one of them. There's also some others that are kind of technical, but chronic care management is a way for family doctors to kind of get reimbursement for basically reviewing patient data over the course of a month. They have to spend 20 minutes a month on that, and that can include updating their care plan. We also have basic telemedicine, so that's kind of a commodity in the space now, but that's the virtual visits, much like we're doing right now, but HIPAA compliant. And we also offer transitional care management, which is for patients who've been discharged from skilled nursing facilities, and behavioral health integration. And behavioral health integration is really coordinating care between different members of a patient's clinical care team, like a social worker, a psychiatrist, an addictions counselor, a family doctor, and for patients who have either mental health issues or addiction issues. And that's unfortunately extremely relevant today. So that's a module that we're seeing more and more clinical providers asking us for. So this slide just shows what a physician would see when they, or a home health agency or skilled nursing facility case manager, when they log onto the system from their end. So they'll be able to see all of their patients in this dashboard format. They can click on a patient to actually drill down into trends. So, I just got an alert that this patient has very high blood pressure today. I'm going to log on and check medication compliance and what their blood pressure has been for the last month. So I can see, has the blood pressure been steadily creeping up and we need to do something, or is this a one-day spike and it looks like they forgot to take their medication, which is easily resolved. So it helps physicians and other healthcare providers really triage those chronic condition patients and ensure that the ones who need attention receive it, and do so at an early enough stage that the response doesn't have to be go right to your nearest ER, but an intervention that actually will help keep them healthy and at home. I won't dwell on this slide, but we have a secure cloud-based platform. It's HIPAA compliant, which is obviously critical in the healthcare space. It's very secure. We use industry standard or gold standard encryption protocols. It's also inherently scalable. So it was built from the ground up to work with literally millions of patients on the platform simultaneously. And so it gives us a lot of room for growth. It's also highly interoperable. So we really can plug and play with any medical device that's out there. So, we're hardware agnostic, we say, whether that's, an iHealth glucose meter or a Withings blood pressure cuff or a Fitbit or a Garmin or an Apple Watch, or even a kidney dialysis machine that's used in the home, or a CPAP machine that's used for sleep apnea patients. So really, we plug and play with 99% of what's out there, and that gives our clinical customers a lot of options when they decide they want to roll the platform out in terms of what devices they prefer to have their patients use. Our business model. So we charge a subscription fee based on the number of patients on the platform. It's a per month subscription fee, but it's not paid by the patient. So we're charging between $25 and $100 US per patient per month. Currently, our average revenue per patient is $40 US, but we expect per patient per month. But we expect that that will increase over the rest of this year as we provide more of our case management services to clients, and also as clients add more modules. So we are finding that, where we started the business in 2017 and 2018, the only billing codes available from Medicare and Medicaid, there was only one from Medicare, was for remote patient monitoring. But over the last 5 years, they've added a significant number. There's now over a dozen billing codes that cover our services. And so we've introduced new modules to work within that framework. And most of our clients have their patients on multiple modules. So we expect that average revenue per user of $40 US per patient per month to increase as we move forward. Our clients are skilled nursing facilities, physician practices, home health agencies, and we are paid by the client. So we send monthly invoices and they pay us based on the number of patients and based on the number of modules those patients are using. And the clinicians receive payment from Medicare and Medicaid or private insurers. And the overall market for this space, our total addressable market, is currently that 37 million Medicare and Medicaid patients who have 2 or more chronic diseases. But the private insurers who are starting to get on board with this kind of approach to healthcare represent more than another 37 million patients. It's a very, very large, very rapidly growing market, currently valued at about 100 billion US, but lots of room for growth there. And so just to kind of drill down a little bit more around the financial incentives for clinicians, certainly for patients and their families and for clinicians, there's obvious clinical benefits. A typical chronic disease patient population, 20% of them would end up in hospital at least once in any given year. And with iUGO Care, we're able to reduce that hospitalization rate to under 1%. So it's a really significant difference between taking that proactive technology approach to healthcare and taking the kind of rescue approach that we've had more traditionally in healthcare. So for patients, we reduce hospitalizations, improve health outcomes. We see a significant increase in patient satisfaction. And so patients and their families are very, very happy to use the platform. They really appreciate that there's a safety net there for them now that wasn't there before. And they tend to be much better about taking their medications and collecting their vitals and making other lifestyle changes when they have that accountability, when they know that their data is being monitored and that they are going to have to, ultimately have a reckoning with the physician if they're not doing what they're supposed to do. And we've also found that patients really appreciate that, they can go back and look at trends over time in their own data and say, that month that my son bought me that exercise bike, my blood pressure has been much better ever since then. And so it really does engage and empower patients very uniquely. And that alone is one of the most significant predictors of improved health outcomes in patients. So for the clinicians, their motivation is Medicare and Medicaid have introduced penalties. So if your patients have preventable hospitalizations, whether you're a skilled nursing facility whose patients are being readmitted or a physician or home health agency, Medicare and Medicaid can actually claw back a percentage of the payments they've made to you during the year. So there's definitely a stick there that's incenting physicians, but the carrot is Medicare and Medicaid determined that by investing $100 billion a year in this upstream proactive approach to healthcare, they can potentially save up to $1 trillion a year going forward. And they validated that over the last 2 to 3 years. So they've increased the number of billing codes available and also the total payment for those billing codes. So when we started, when Medicare first introduced RPM in 2018, the total that a physician or home health agency or skilled nursing facility could receive in reimbursement was around $59 per patient per month. And that's increased to over $315 per patient per month. So that's a completely new revenue stream for a physician who introduces this kind of a virtual care platform. And Medicare and Medicaid say that the average physician practice can generate an additional $500,000 to $1 million in revenue per year by employing this kind of proactive technology-enabled approach to care. And it's basically pure profit. I mean, we're taking roughly $40 out of that, $315 a month. And so it's a very financially compelling business case for the clinical care providers. And it's a relatively new one. So, you know, the billing codes have increased in both number and in the actual amount of money that they're, pardon me, losing my voice today, the actual amount of revenue potential. But certainly, you know, this year, there's a lot of pull in the market for our platform that wasn't there even a year and a half, 2 years ago, because those billing codes have increased so substantively. I won't dwell too much on this, but you know, our customer base is primarily in the U.S. We work with a number of large skilled nursing facility networks, as well as with networks of physician practices and home health agencies. In Australia, we've deployed a unique product of ours called iUGO Well, which is an app-based product, and it's focused on kind of the younger end of the spectrum, patients or rather individuals who are typically fairly healthy. And it's really a physical wellness and mental well-being app. And so that's something that the University of Notre Dame in Australia is using for their 10,000 students and faculty and staff. But it's something that will be certainly, I think, relevant in North America to employer-sponsored plans who are looking at employee wellness options. Our growth forecast, so as Jack has highlighted, this is definitely our breakout year. This is our inflection point right now. And we expect that next quarter will be profitable, and that by the end of this year, we'll grow to 11 million in revenue. And by the end of the year, we will have reached the critical scale at which we achieve our target gross margins and EBITDA margins. So we'll have gross margins over 75% and EBITDA margins over 45%, which is somewhat typical in the SaaS space, but not necessarily typical in healthcare. So very compelling margins from that perspective. Next year, with listing, we expect to have at least 32 million in revenue. And we'll continue to see that very, very rapid growth year over year going forward. If you look at companies like Livongo, which was acquired by Teladoc last year. At the time, they were doing about 240 million in revenue, and they were acquired for 18.5 billion at a point where they were still operating at a loss. So, you know, if you want to do the math on that, that's 77 times revenue. And there's sort of no number you can use to calculate because they were at negative EBITDA at the time. But so their EBITDA multiple obviously would have been much higher if they'd had a positive EBITDA. But the multiples in this space are certainly very compelling. You know, there's a trend towards consolidation in this industry as in every other. But, you know, even for companies that are not being acquired but are publicly listed, there's definitely significant value assigned to healthcare technology companies, because I think not just the capital markets, but the market as a whole, including our customers, really recognize that this technology-enabled approach to healthcare, where you're really focused upstream and everything's not about just putting out the fires when they happen, but actually preventing them in the first place, is really the future of healthcare. And the last slide I have, I'm definitely not going to spend a lot of time on. I actually think it's a little bit out of date. I've got to update that, but this is just a little bit about some of our share metrics, so you're welcome to review that at your leisure. We have a few warrants outstanding from the last private placement, but not a lot, and not what I would consider hugely substantive. And management and other insiders are definitely key players, key shareholders in this business. I myself have put a lot of my own money into the business because I really believe in what we're doing. I think the company will do very well, but I also think we're going to do a lot of good. So, you know, there's a there's very few opportunities in your career to be part of something that really contributes to society at the same time that it, delivers shareholder value. So I think that this is a very unique opportunity, and we're all very, very proud to be part of it. So I'm happy to answer any questions you may have, Jack. I can stop sharing.
Okay, Lisa, can you hear me, see me?
I'm trying to stop sharing and my computer's not cooperating. There we go.
Okay, you see me and hear me?
Yes, yes.
Okay, perfect. Okay, okay, we got a bunch of questions coming in here. It looks like people are pumped up with the pace of deals coming in. So let's go to the first question here.
Okay.
What impact has the recent Texas weather had on onboarding patients?
Yeah.
Anyone currently, and is anyone using the IU Go? They need electricity to use this, right?
Yes. I mean, I will say that some of our more remote and rural patients often have generators. I've discovered that's something quite common in the remoter communities. It's definitely been tough for them. A lot of our, not even our patients, but a lot of our employees are in the Texas area, our implementation team have been without water and electricity, but they're soldiering on. I think definitely our patients are continuing to collect their vital signs. So, whether they use battery operated devices during that time, and we can do things and do things like have our call center temporarily step in and actually collect data over the phone. We also have our interactive voice recognition, our IVR product, so we can do automated calling to those patients. Obviously, if everything's down, landline, cellular, electricity, water, we just are in a holding pattern, but they are starting to come back. They've just had a tough time.
Okay, so Anthony's asking, are you full? I mean, right now, basically, you're at a point to scale, right? You're at this. So Anthony's asking, are you funded are you fully funded to scale from here?
Yes, so we expect to be profitable next quarter, at which point we'll be throwing off a fair bit of free cash to fund the business. We just did a private placement that closed at the beginning of December last year. So I think we're in a very good position moving forward. If we were to sign some unanticipatedly large contracts, which is certainly always a possibility, and we wanted to raise growth capital, we would do that, at the right time when we were at a higher valuation. But I think if we were to decide we wanted to raise, that would be very good news, because it would mean that we're expecting growth above and beyond what we already forecast. But it's not something we're contemplating at the moment.
Okay. We get a bunch of variations on this question. What makes you different from what else is on the market? So if you want to maybe give us like a spreadsheet.
Yeah. So essentially in the market, I won't say competitors, because there is really no direct head-to-head competitor. If you look at the clients that we've acquired, like iDocsWeb and Digimed in Puerto Rico, they came to us, including the one we just announced in California, after doing global searches for a company that had what they needed. So we have a very comprehensive suite of services. Our software is, very powerful, but we also built the platform specifically for the community market. So most of what's been developed to date, like Vivify or Philips or TELUS, their remote patient monitoring platforms, were developed for hospitals to use post-discharge on patients. But those platforms have to fully integrate with the hospital's electronic medical record systems. So they're very complex, and they require a hospital IT team of dozens to hundreds of developers to support the implementation and ongoing support and maintenance. And they're very expensive. They're millions of dollars up front and millions of dollars a year. And that just won't work in the community space. People in the community, the physician practices, skilled nursing facilities, home health, don't have an IT team. So they cannot deploy that complex software. So we have very complicated technology, very complex technology, but not from the user's perspective. So for both the patients and for physicians, we have a very, very simple user interface. It's very robust. You don't have to worry about downtime. It's going to take you 5 minutes to learn to use it. And that's very different from what's conventionally been built in healthcare, because historically the budget was always in the hospital space. The competitors we actually see in the market are smaller kind of mom and pop shops who've built their own RPM or chronic care management platforms. They tend to have either been built by doctors, so they have great clinical workflow but a terrible technical experience, or they were built by developers, so they have a great technical experience but terrible clinical workflows. And we usually are able to displace those vendors quite quickly. We haven't come up against anybody in the market who offers everything we do, and that's why these larger clients are coming to us. I mean, most of the big clients we've gotten, not that we don't do our own business development and secure contracts that way, but a lot of these groups have come directly to us, despite the fact that we're a relatively small Canadian company, because we do have, and we are the first movers in this space in terms of the community care space. And we really built the platform specifically to support the unique use case of the community. And that's a huge market. I mean, you know, in terms of community care, basically, all chronic disease patients are receiving the bulk of their care in the community. But up until about 5 years ago, really nothing was being done with those patients. So we were the ones who kind of got out first and built something uniquely tailored to that patient population.
Okay. We got some more technical questions coming in. So Farron's asking, can you provide detail on how your software grabs data from the home devices, most of which use proprietary software?
Yeah. Yeah. So essentially, we use APIs. We can, as I said, plug and play with most of what's out there through our middleware layer. We use, I saw they asked, we use, you know, message level encryption as well as, you know, standard encryption in the servers. I'm trying to think what else was in their question. So we connect to the devices either over internet. So if the patient's home has Wi-Fi, we connect via internet. A lot of the patients do not have conventional internet access. And so we actually use devices that have a little SIM card in them. And we collect the data over the cellular network. A lot of the patients that we work with, they're 75 or older. They may have visual acuity issues, maybe, you know, some cognitive issues. And so they are not going to learn how to use an app on a phone or a tablet or a computer interface. And so we actually have devices with these SIM cards in them, and they will talk to the patients. So it'll say, you know, it's time to collect your blood pressure, and they'll say it in whatever language is relevant to the patient. It's time to collect your blood pressure. Please come over and put on the blood pressure cuff. The patient will do that, and then the data is immediately uploaded over the cellular network to our servers. The patient, if they don't want to, you know, doesn't even have to know what their blood pressure was. They certainly don't have to record it themselves on paper, which is what they typically would do before they used our platform, or enter it manually through an app or a tablet or a computer. We know that this particular generation is not terribly tech savvy and not really interested in learning how to use a new app or a tablet or a computer interface. So we've really worked hard to build something that meets these patients where they are, but still delivers the full experience of having that kind of virtual nurse in the home with you.
Okay. Yes, it's a very important, because I mean, you know, I'm not 70 and, you know, I don't want to learn how to use apps. I mean,
yeah, no, I got my mother and my stepdad, who are both physicians, an Apple TV for Christmas a couple of years ago. And every time they want to use it, they call me and they're like, how do I turn it on? Where do I find my program? So lots of people are brilliant in many ways, but not great with technology. And we really, it's very important to meet patients where they are.
Right. So basically, so your technology is essentially it's easy to that's I think that's the biggest issue, is like, is it something that's, you know, like, you know, simple?
Yeah, if you want to get compliance out of this patient population, you have to figure out exactly what works for them and do that. And that's part of why we developed, as we announced, I think last month, our interactive voice recognition platform. So if you're a patient who has a landline and that's as far as you're willing to go, then we can actually have these automated phone calls. We do them now in Spanish, English, and Russian, but they could be in any language. We have a large Russian population in Maryland, coincidentally enough. And so the call will actually go out to the patient's home. It'll ask them, you know, can you please check your blood pressure? Please read me what it says. They read it. It goes automatically. It's translated into that, you know, data that we need in the platform and uploaded to the platform. And then it can provide medication reminders. We also do medication reminders for patients who have memory issues and need a little bit more help through the You Go Home, either the pendant or the watch that they wear. And those will also provide, you know, geofencing. So if they leave the home, it'll trigger an alert to typically the family members, but if they're in a facility, to the facility staff, and then we'll allow them to track the patient so they can follow them. But we've really developed a technology that's a platform that's very flexible and therefore allows us to serve patients in a wide variety of circumstances who have basically any kind of chronic clinical condition you can think of.
Okay, no, so it's very and so what was it, a few weeks ago you announced was it the contract with in California with it was like an Asian community, and so is that Chinese? I mean, does it like talk to
Uh,
them in Mandarin or like how
yeah,
does that?
Korean,
Oh,
Chinese. It's
oh,
there's
actually in LA. There's a very big Korean population.
I think there are 250,000 Korean Americans living in LA alone. There's a large Korean American population in California. There's a large Asian American population, and
Yeah,
we've definitely found with the elderly patients in that community that they really like to have all of their services delivered in their own language. It's just that much more comfortable.
everybody does. I mean,
So,
yeah.
we're one of the things that's really unique about our platform is that we can deliver our services in any language. So that was a really key selling feature for that particular contract. And a large group, they have 50 clinics and over 500 physicians. That translates to a lot of patients.
Wow. Okay. So that's question. So I guess I think maybe the question is,
Yeah.
do you have enough staff to for onboard?
Yeah, I mean, one of the things that the pandemic, I begrudgingly give the pandemic some credit for is we had a year during which we could really focus on turning all of our training materials into virtual packages. So webinars and online. We have an online help service, Freshdesk, that does a lot of customer support if anybody has any questions or needs additional training if they forget how to do something. So we don't actually need to be physically present to do onboarding, which definitely helps with COVID. The biggest obstacle for us right now is COVID, because if you are, for example, a skilled nursing facility and you have outbreaks in a number of your network and you have outbreaks in a number of your facilities, you're focused on keeping people alive. You are not worried about post-discharge care or any kind of proactive approach. And we certainly see that in South Texas, that a lot of the physicians have had to start working in the hospitals and in long-term care facilities just to keep people alive. So right now, we're in the business of preventing forest fires, but there's a massive forest fire raging. So a lot of our clients have to focus on that over the next few months while the vaccine rolls out. But by the end of June, once the vaccine's gone out to frontline healthcare workers and patients over 75, and that's where you're really going to see that rapid, explosive growth in the company. And we are definitely onboarding now. We onboard more patients every month compared to the previous month. But where you're going to see that really take off is in the second half of this year, once the vaccine has been deployed to some of these client populations.
Okay. Susan's asking a question with all the competition question. So with all the competition that's in the telehealth sector, do you see any impact to your subscriber services diminishing with Truveta? Who's Truveta?
I'm not sure off the top of my head who Truveta is, but there are a lot of players in the telehealth space. And what I would say is that most of them either have overly expensive, overly complex platforms that work really well with hospitals, but don't work very well in the community. Or they have, like a Livongo, very human resource intensive platforms. So they rely on a lot of coaching that's done by qualified healthcare professionals. So the business is more difficult to scale, and it's also much more costly because you have that much more human intervention. We designed a platform initially aimed primarily at Medicaid patients. So really the underserved communities that are on kind of the fringes and are very challenging to serve. So they're remote and rural. They don't have conventional internet access. These are patients who are living below the poverty level. So a lot of challenges in that patient population, and we built a platform specifically for addressing those challenges, and really no other company has done that. Certainly our platform extends into the more conventional Medicare population or the private insurers, but we have probably the most cost-effective platform that's out there, and certainly the most powerful and most comprehensive.
Okay, so it's very interesting. I think there's when people say telemedicine, it's not like one or two companies are going to get the whole market. There's a lot of niche areas in this. Like there must be 100 different niche areas. Like in terms of language, communities, everybody has like a different thing.
It's a massive market. I mean,
easy to use. Everybody, it's a lot of differentiation with everybody.
Yeah, I mean, a lot of what's done in telehealth isn't even aimed at chronic disease patients. It's, doing these virtual visits. And we're very focused on, there's roughly 75 million chronic disease patients in total in the US. That's a big number, and it grows every year. Certainly the global number is even larger, and that's our primary focus. And we've gone to great lengths to design a platform that really works in the Medicare, Medicaid environment, because that's the most challenging environment. So, if you can make a profit there, you have a very compelling product when it comes to selling to the private insurers.
Okay. Good question. Can we get a demo at some point?
Yes.
Screen share.
Always happy to give Dwight Schrute a demo. Yes, you can definitely get a demo. I think you sign up on our website. Generally, that's how people would get it. But I can get one of my team to do a demo here on the program at some point.
Yeah, so we should do, like, the next one, we should do like a screen share like you do with the slideshow. Whatever is on their screen, we'll happy to share. Okay, so let's wrap up. We're running a little bit behind. So I guess I'm gonna kind of close on this, which is the growth strategy. So you had a very interesting slide on the screen where, I think last time I asked you, like, what is the path? Is there a path to be, $1 billion company? And you actually had a slide that actually kind of laid out the path, which I think it's going to happen quicker. It's at 100 million. If you get to 100 million revenues, that will give you 10x. That's your billion market cap.
Yeah, and I do think multiples in this space tend to be much higher. We tend to be very conservative in our financial projections. I think people look at valuation different ways, and so you're welcome to do your own modeling. But I think we'll get there much more quickly than we estimate in our more conventional projections. Our growth strategy is really, we have quite a few contracts. We've announced all of them. So obviously there's many more in the pipeline as well. But just in terms of the contracts that we already have, that we've already announced, that would get us to at least 11 million in revenue this year. The bulk of that growth, as I say, will come in the second half of the year when our clients are more free to focus on the proactive side of healthcare and not just saving lives, and immediately saving lives. This does save lives over the long term. So our growth strategy is really, we have commitments from these clients, we have the contracts, and we know that based on just what we have currently announced, we can hit our revenue targets. But obviously, as you saw with the most recent contract that we announced with California, there's a lot of potential upside associated with our ongoing business development efforts. And we certainly, where we started with the business in 2017, 2018, we're focused on much smaller clients because that was who we could attract when we were a new entrant in the market. We now have 2 years, 3 years worth of clinical data that validates that our platform works, and that it generates these improved health outcomes and reduced spending. And so we're now able to attract much, much larger clients and big networks of skilled nursing facilities and physician practices. So, our growth strategy is really taking advantage of that acceptance and that pull from that group and selling to the larger clients going forward.
Yeah, so it's very interesting. A lot of times people expect, company, small cap company, they start and they're going to have immediate traction. Everything is going to go perfectly, and it never works that way. Usually it takes a few years to get the kinks out of this, and this is what happened like in the last couple. So at this point this is the inflection where you got the contracts coming in. So good time to get on board. I think, okay, so I made a couple of notes here. So a takeaway for me is, again, you're basically, we're starting to see the pace of deals. Three deals last 30 days. I think we're going to see more like that, I think. And you said that 11 million this year, 11 million revenues this year.
This calendar year, yes.
Calendar year, 2021, 11 million revenues. Okay, so, the market is, the market is not valuing companies at 10x. It's going like, 50. It's the numbers are going crazy right now.
Yes, they are.
And especially if, essentially if the market sees the pace, kind of that pace of growth, that they see, acceleration of new contracts, you might get 50x, multiple. So next year you said you're going to be doing 32 million revenues, 22.
Yeah, conservatively we think 32.
Conservatively.
Yes.
Okay, so that's that could be $1.5 billion market cap next year.
it could be, you know, I never like to predict the market and how it's going to react to things. I've had in my career, you know, the biopharmaceutical company I was at, we had 9/11, which had a significant effect on the capital markets. This company's had the pandemic, but certainly I think that there's long-term fundamental value in this business. You know, we're not kind of taking advantage of you know, the sudden attention that healthcare got, especially virtual care got during the pandemic. This is something that has a long-term value proposition, and with Medicare and Medicaid and the private insurers really significantly increasing funding around these kinds of initiatives, there's a real business here that will certainly grow significantly for the next 3 to 5 years minimum. I think you're looking at essentially kind of explosive.
Yeah. No, so the value proposition, maybe just we'll close on this because this is like basically the sales pitch. So the value proposition is, I saw the numbers you had, like the population that you serve, 20% of them end up in the hospital, like a serious problem, right? Each year, right?
Right. Yeah.
Okay, that's expensive for the insurers, everybody else.
Yeah, I mean, typically these patients are seen in the ICU because they have complex chronic diseases. So it's hundreds of thousands of dollars when they go into the ICU. It's a huge expense. So we can reduce the average cost of care for one of these patients from anywhere between, you know, $25,000-$50,000 to $300,000 or more down to $2,000 to $4,000 a year. So it's a huge cost savings for the system, and it's really what especially Medicare and Medicaid need in order to be sustainable going forward.
Yeah, in terms of and with the numbers that you've seen, the percentage of patients that go into the hospital, you know, to the ICU with your, what's the percentage?
So we can reduce that 20% down to under 1%. And just a little intervention in the home, like a proactive technology platform, has very dramatic impacts on health outcomes. I cannot overstate that.
Okay, so that's a massive number, from 20% to 1%. So in other words, if you have 10,000 people in your system, that's, you know, 2,000 people going to the hospital at $50,000 a pop, or let's say $100,000 a pop. That I don't even know, the numbers are staggering, versus 100 people. So
exactly. That's why this is the future of healthcare. We have to do this. It's not, you know, a fun, nice thing to have, and you know, we put it in during the pandemic and then we, you know, stopped doing it. Like it may happen with some of the just basic virtual visits, but this is something that we absolutely have to do, both to deliver better patient care and to keep, you know, the budgets available for healthcare for all of us.
Okay. We get a bunch of questions coming. We're kind of out of time. We're gonna have to catch up with everybody's questions in about 10 days, 2 weeks. Lisa, I'm gonna end on this. Is you know, what kind of news flow can we expect in the coming, let's say, 30 days? What else do you have in the pipeline? Can we have a situation of new deals announced? Do you have anything?
I mean, certainly, you know, I obviously can't announce news before we announce news, but, you know, we definitely are very active in our business development activities. There's a lot of market pull for the platform that, you know, has really evolved over the last few years. And so we get a lot of inbound calls and a lot of inbound sales. So I think, you know, certainly we'll be keeping the market informed every time we sign a new contract or go live with a new client. And I think, you know, for me, running the business, one of the key milestones for us is that next quarter we'll hit profitability. And, you know, from there, it's just a basically free cash generating business, which is, you know, very good place for a business to be.
Excellent. Okay. On that note, Lisa, thank you very much. We'll catch up on the next live stream.
Okay. Thanks very much. Take care.